Are you comfortable being recorded?
Yeah. Good morning, and thank you to our host, Representative Kraftharp, Senator Zinzinger, and the Behavioral Health Task Force. My name is Vanessa DeMott. I'm a native to Jefferson County. I met my husband in 8th grade at Mandalay Middle School, and I'm in my last semester at Front Range Community College with a focus on all things behavioral health. Currently a candidate for State House District 29, but for right now I'll just be a mother to 4 amazing children. Today I share our family's journey because I am strengthened and inspired by the stories of the families in our communities and absolutely what I've heard through this testimonial process. As a parent, I probably don't have to convince you that there's nothing you wouldn't do for your children, but sometimes it's not what you wouldn't do, but simply what you can't. A few years ago, my daughter's battle with mental health became more public and symptoms became more frequent. She began with small signs of self-harm, cutting on her hands and arms, reported auditory hallucinations, and had suffered night after night with insomnia. Our diligent school staff became just as concerned. And as a new chapter in our story as parents was being wrote, we just prayed this would not be the final chapter in hers. Calls from the schools increased with the same pattern of action requested. Sign this form, have her seen by a professional, she can return to school tomorrow. Trips to the emergency room and crisis clinics were a good start, but only helping in the immediate. Her cutting was visible daily, plans to take her life became more elaborate, and insomnia worsened every night. By October of 2017, we had no choice but to have her evaluated at an inpatient psychiatric facility. That week was hands down the worst week in my life. Although I knew deep down we would have answers, I selfishly just wanted her home with me. In the weeks following, we would learn that she had a biologically based depression and a mild form of schizophrenia. This explained a great deal about her temperament, mood, and sleep patterns, and for once, gave us path for treatment and hope. So as a family, we adjusted to our new routine of medication, counseling, and persevered on. But as time out of the classroom for psychiatrists, therapists, and an ongoing need for her personal safety showed its effect on her academics, we worked with the school to transition Adia to an IEP, an individualized education plan. This is part of the American with Disabilities Act. This IEP allows educators to make necessary accommodations to support her and get her through. Her qualifying emotional and mood disorder is a recognized disability. So for over a week, Adia was in and out of testing to comply with the standards in order to qualify for the IEP, all while still being a 13-year-old girl in middle school. Anybody remember middle school? Anybody want to go back there? By the end of that week, her limit had been met and she'd had a psychotic break at school. Staff, unsure what to do, had her handcuffed, placed in a patrol car, and transported to 2 different facilities before an ER would take her out of the officer's custody. My daughter was asked to submit urine, blood, and undress without a parent there, simply given her state of mind. This response was callous, uncompassionate, and incompetent. I could share with this task force the in-depth successes and failures over the past 4 years. I could share with the room the agonizing pain a mother goes through when her child is hurting and we don't have a Band-Aid, medicine, or answers to make them better. I could share the angst in our home when your child is cycling through days of mania, running into traffic, trying to break her own fingers, or the long days of depression, wrapping her in a blanket, bringing her food, and watching TV in the dark, or abandoning the cart full of groceries in the grocery store to leave during an anxiety attack. I'm so sorry whoever got that one. I would rather share where we are today and where we can be with collaboration, compassion, and action. Today, Adia is doing better. The IEP has allowed her to be placed in a specialized school with our amazing Jefferson County Public School District, and with a tremendous amount of support from professionals and a smaller class size. Again, our persistence in advocating for her needs cannot be overstated. We are now seeing signs of schizoaffective disorder, which is some of my professional friends call the double whammy. Positive symptoms of schizophrenia, auditory hallucinations, extreme paranoia, involuntary and often painful muscle spasms, and bipolar disorder with rapid cycling, all of which show great response to the right mix of medication, diet, and therapy. And in most cases, it sounds like they regress as a patient gets older and their brain develops. As each week passes, though, I grow frustrated with the growing stack of medical bills because her therapist, 1 in 1,000 that she could connect with, is not within my insurance network. Any parent in this room will tell you the mind-numbing experience to scroll through the endless list of providers within your insurance network and hope just one of them will be an appropriate fit. This is not a cry for a universal plan. This is demanding common sense insurance reform to allow mental health services, especially ongoing outpatient therapy that is proven to reduce costly ER and inpatient hospital interventions to be covered consistently at in-network cost. This preventative care is just like a well-child checkup, flu shots, sports exams. This keeps the mind in a safe and healthy place. As mentioned, we are no strangers to emergency rooms. Although the response may vary, sometimes a talk screen, usually a social worker, and always at the end, here's some info, get some help, see you later. There's always one thing in common, which is the massive, incomprehensible bill. One diagnosis code would help to say my child was seen for a mental health crisis intervention, that it would include all the labs, all the prevention, all the professionals, even the transport. So no citizen, urban or rural, adult or child, should ever be placed in handcuffs because of a devastating emotional condition. I have heard countless stories of parents who do not seek help because of the cost. This is another area where great policy can help make access to care with insurance they already have. I myself have had to beg a school resource officer not to call an ambulance because of that cost alone. And in turn, the time off from work becomes just as costly to react and care to your child in need. Ladies and gentlemen, as I close my story and have made a few requests to a good place to start, do not pretend to have any magic solution. Each day in our home presents its own struggles, but each day ends knowing we won the battles for now and we will wake up and do it all over again. Wake, breathe, live, repeat. Let me leave y'all with a few numbers to connect to the bigger picture. These were a few years ago, so God, I hope they've changed. I recall I believe in 2018, Jeffco Public Schools had responded, information I heard in this very room, to just over 1,100 active school threats. So those are those larger threats, active school shooters, whatever that is. That's a big number. But in contrast, that same year, Jeffco responded to over 2,200 individual suicide risk assessments. That is a big number. And I know that because my daughter probably accounts for at least a dozen of those. I get it. Colorado, in the leading cause of death in our youth ages 10 to 18, suicide. So again, what I can't do as a parent can become what we can do as a state. I'll leave you with one of my favorite quotes that I say to my daughter. To the world, you may be just one person, but to one person, you may be the world. It's by Dr. Seuss. Thank you guys so much.